Let them eat Ponchki. My name is Werner Puchert, and this is Finding Frequency. Ponchki, it's the Polish word for what I can only describe as a donut. In South Africa, we call it a vetkoek. It's just a sweet ball with sugar on it. And why am I saying let them eat? So, if you're familiar with history and probably you've heard this saying before, let them eat cake, it's ascribed to Marie Antoinette. Apparently, she said that when the people were standing outside of the castle shouting that they wanted bread, and she said, let them eat cake. Now, apparently, subsequently, I found out that she never actually said that. The urban rumor. Anyway, why am I saying that? It's a difficult episode for me to do today because in one way, I wanted to jump on the bandwagon and make statements and say how I feel and what is right and what is wrong, but what the hell is the point? So why am I a little bit upset today? Now, as much as I love my dear country in Europe and my adopted country, there's so many mistakes, so many things going on that frustrates me. And I don't know what to ascribe it to. Is it just because we have become complacent, scrolling through endless reams of content, not really caring about what's going on around us? Is it because we are scared of things that we aren't really supposed to be scared of? The unknown. All these immigrants who are going to come in and steal our jobs and steal our things out of the garage. That we vote people in that don't do much either. And then when things hit the fan, the proverbial shit, we fight amongst each other because we wonder why and who should take responsibility. And why am I saying this? Why am I going on and on about this now? Now, I've been frustrated a little bit with some of the things that happens politically here in Central Europe, because I think it's kind of a nucleus of a lot of things that are going on everywhere else. There's a lean to either side. You're either a lefty or a righty. There's no centery, either or. And one side thinks the other side's idiots. But I think we're being played because here in Poland, we have the right side scaring everybody about the homosexuals are going to come in and take all our children and then we're all going to give up our religion and just run away. We should all chase them in the sea, right? Let me tell you a story. My father-in-law went to hospital probably, 2 months ago for operation. Serious, very serious. And we couldn't go and see him. Understand that there's a pandemic. We need to think about everybody else's health and wellness, especially those who work in these hospitals. I don't want to do that job. It's a hard job. But then also subsequently, what I found very strange, and sometimes I just wrote it down as maybe it's just one person. Don't measure everybody against that or this and that and this. So my family went to see him last night. And I got a photo. My wife sent me a photo of my father-in-law. I was shocked. I don't want to get into the details, but he didn't look good at all. Now, from a medical perspective, they've done a good job, in my opinion. They saved his life apparently twice. But when I saw him, and even when my wife described him, he was neglected. He was unshaven. He didn't look good at all. Fingernails were, He told them that he had to ask them for water. They didn't bring him water out of their own. And then also, we've been told certain aspects of his condition that turned out to be not true. He's fighting us. He wants to get out of there. And this is one person. And I know my family, my in-laws, they aren't the easiest people. They're also very clever people. They know how to self-diagnose and Google medical terms on the internet. And we know how safe that is. So understand when I say, I don't think they are little angels. But I am shocked. I feel uncomfortable because I have experienced and I've been relayed to and told what people were saying when my wife, my mother-in-law, phones up the hospital to get a status update, because you can only phone in a certain period of time, and heaven forbid if you phone outside that time. Now, I'm kind of cool with that. I like boundaries. And for example, the other day when they moved him and we tried to get a number, we didn't phone in the prescribed time to get a number of the new place. And the person on the other side lost it. Not in a nice way. They lost it. Now, up until this point, I've been giving them the benefit of the doubt. But now I'm also starting to ask myself, what will happen if Francie gets sick? If Martha gets sick? And they have to go to this hospital. And then this morning, my wife told me, because we have family here in Poland who work in the medical, at hospitals. Apparently at one hospital, they measure people's temperatures as they enter the building. And they got a new doctor, or a trainee doctor, to do this. This person is standing at the door measuring temperatures. The thermometer doesn't work. It kicks out the same number all the time. And when she highlighted this to her supervisor, he just told her, just keep on going. Another hospital, and this is a friend of mine that I know that works there, refuses to pick up the phone if it rings and has a number of the city. So if Warsaw City phones this hospital, they don't pick it up. They ignore the phone calls. Because they know that they will be asked to take a COVID patient if they pick up the phone. They don't want them there. Now, let's not get started about what happens in Africa. And I have family who work in the medical practice in South Africa, and I appreciate them every day for what they do there. Because fuck knows, they're not getting support from the government. So I don't know. How do we fix this? What do we do? How do we... it's the same with the police. We've got these meatheads running around shooting people up. And there's a saying. I know it from South Africa. I don't know if it's like across the world, but if you pay people peanuts, you're going to get monkeys. Now, the question is probably, where's the good people these days? Because they're not going to work for peanuts. They're going to go where they are appreciated. And maybe we need to think about these things too, right? And I'm not saying all policemen are bad. Some great people out there. People who are trying to make a difference. And knows, there's a lot of people who work for the money and still do a sterling job. For example, my father-in-law relayed last night in some of the stories that he told that he's in this Polish hospital. And he wasn't treated great. Especially when it came down to like the basic stuff like asking for water and X, Y, and Z. We also had an incident over the weekend where we wanted to speak to him because he was moved to this new place. And the nurse was standing in his room next to him. And she was holding the phone. And we said, can we quickly just ask him if he needs something, or can we bring something, or what does he need. She refused to give him the phone or even hold the phone up to his ear. She also told us that he's unable to pick up or hold the phone, which we today or yesterday when my wife went there said was bullshit. It's not true. He was able to hold many things while they were there. So my father-in-law continued to tell them that even there in that place where things weren't great, there was one new nurse. Funny, a nurse from the Ukraine who ran around, tried to help him, even gave him her phone to make a phone call, and that's how he reached out to us as the family. So even in that light, I tip my hat today to people who do that, to people who work in those circumstances and then go above and beyond. We need more of them. But what are we going to do about this situation? Because this is not unique. Everywhere. Ask the African, the one sitting behind the microphone. I know. What do we need to change to fix things like this? Perhaps we need to worry less about the homosexuals and the people who come from other countries. Because the people who come from other countries might just be helping you and bringing you a cup of water when you really need it. So I don't want to be negative, but I feel a bit negative. I feel a bit angry today about these things. Puts a lot of pressure on our family, and there has been a lot of pressure even in our house up until this point because of trying to accommodate and understand the perspective of the healthcare professionals looking after my father-in-law. And please understand that there are a lot of people doing great things, even for my father-in-law, to get him where he was. I didn't think he was going to make it. He made it. So I really do tip my hat to that. But where is empathy? Where is care? Where is love? Because, I know patients can't be easy as people. But when you walk into this practice, I didn't want to become a doctor. Not because I'm stupid, because I can't do it. I'm not able to do that. So I have so much respect for people who can do that. But yeah, I'm still grateful. I'm sitting here in my little room doing my things, getting screamed at by other people. And I look over to the screen, I've got 8 minutes to a meeting. So it's all good. It's all good. But we really need to think about things. Maybe we need to think more about things and now allow our governments to think less about things. All our governments, not only the ones we don't like. Excellent. I'm going to try and think a little bit more and encourage my friends and family around me to also think more. Thanks for listening.